Hi, good evening. My name is Jake Lester Reyes from BSN 26. Today we will be performing the bag technique. But first, we must identify what is bag technique.
Bag technique is a tool by which the nurse, during her visit, will enable her to perform a nursing procedure with ease and deftness, to save time and effort with the end view of rendering effective nursing care to the clients. This helps public health nurse to prevent contamination of the bag and equipment, avoid cross-contamination, and establish a clean work area. Protect patients, family members, and healthcare workers.
Now that you know the bag technique, we must also know the content of the bag. What is the materials inside the CHN bag?
Contents of CHN bag: paper linen, plastic linen, waste paper bag, hand towel, surgical gloves, apron, soap in soap dish, kidney basin, gauze pad, thermometer, 2 pairs of scissors, 2 pairs of forceps, disposable syringe with needles, hypodermic needles, cord clamp, micropore plaster, baby scale, solutions of alcohol, betadine, and spirit of ammonia, cotton balls, BP apparatus and stethoscope that carried separately.
Okay, now we will proceed to the bag technique procedure. Before we begin to the bag technique procedure, keep in mind that the blood pressure apparatus must be carried separately. Upon arriving at the client's home, look and ask for a flat surface or table to place the bag. And then put out your paper linen and place it over the table. Clean side out, meaning to say that the clean area must be on top and the folded part is touching the table. And then put the bag over the table. This prevents the bag from being contaminated. And also, keep the strap underneath the bag. Another thing to remind is that before you proceed your bag technique procedure, you must always ask the clients for permission. Next, if the faucet is not available, ask for a basin of water or glass of water in preparation for hand washing. And then, open the bag. And take out the plastic linen or linen. Spread it all over your table. Also, this is a clean side out. Clean must be on top and the folded part touching the table. This prevents us nurses, from having a contaminated working area. And then, take out your hand towel, soap dish, and apron. And place them at one corner in our working area. This is for preparation for hand washing. After that, do the hand washing.
Wipe, dry with towel, leave the plastic wrappers of the towel in soap dish in the bag. It prevents possible infection from caregiver to the client.
After completing your hand washing, put on apron, right side out, and wrong side, touching the body. Sliding the next strap, into our neck, and tie the strap at the back. This will prevent us from contaminating our uniform. And also, this will make us look more presentable. And then, put out the most needed things for selective care. And place them at one corner in our working area. This is for us to make them readily accessible. And then, take out the waste paper bag and put it outside in our working area. This is to avoid cross-contamination in our working field, in our clean area. And then, close the bag. This will help us to have a comfort, security, and maintain our physical hygiene. And after that, proceed to the specific nursing care or treatment to prevent contamination of the bag and the content of the bag. After completing nursing care or treatment, clean and alcoholize the things that you use or the materials that you use during the treatment. This is to prevent the healthcare provider from contaminating the infection and to spread it to other clients. And then do the hand washing again. After completing the hand washing, open the bag and place all the materials inside the bag in the proper places. And then remove apron, folding away from our body to prevent any contamination or microorganism. And place it in the bag. And then keep all the soiled materials and put it on a waste paper bag. And then fold the plastic linen and place it in the bag. After that, close the bag. Next is to get your bag and fold the paper linen and place it on the flap and cover of the bag, or you can use your pocket of the bag. This is to prevent the spread of contamination of the contents of the bag. And then make past visit conference on matters relevant to healthcare, taking anecdotal notes preparatory to final reporting for reference for future visits or follow-up. Record all the relevant findings and the client and family members, and document all the nursing treatment that has been done to provide data for the next visit or follow-up. And lastly, make an appointment for the next visit, either in their home or clinic, taking note the date, time, and purpose for the client's availability for that day. I think that's it for bag technique procedures. Thank you for watching.